Hi, thanks for joining us. Rachel Dyer and Karen Carter are here with Carol's Wish to put on the seminar for Medicare open enrollment. A little bit about Carol's Wish. We are under the umbrella of COCA, and our goal here is to assist gynec cancer patients through their journey with their cancer treatment in the sense of finances. If they have any issue with finances or are stressed with finances, we will chat with them and walk them through a pretty comprehensive program that we now have that will not only address their perhaps medical issues, but medical payments, but other stressors of the financial end as well. So Rachel's going to start with the preliminary on Medicare, and then we will go to the Medicare site just to run you through the preliminaries on how you can sign up on the site yourself as well.
Super, thanks, Karen. So, and hopefully afterwards, at the end of the presentation, we'll have time to answer some questions. But we'll also include our contact information at the end, so you can feel free to reach out to us anytime with any questions about Medicare or anything on the financial side of your treatment. So, as you may already know, the open enrollment period for Medicare Advantage for coverage beginning January 1st is October 15th through December 7th. So if you're already in a Medicare Advantage plan, you do have another opportunity to switch between Medicare Advantage plans or to switch back to original Medicare in the first quarter of the year, but coverage will not begin until July 1st. So what can you do during Medicare Advantage open enrollment? Well, you can switch from original Medicare to a Medicare Advantage plan. And the reason this one is highlighted on here is because this is the only time of year that you can do this without special circumstances. So now you can also switch from a Medicare Advantage plan to original Medicare, switch between Medicare Advantage plans, or switch between join or drop a Medicare prescription drug plan. So all those three in gray, you can do, as I said, during the first quarter of the year as well. Coverage won't start until July 1st, but you cannot switch from original Medicare to a Medicare Advantage plan during that time. This now, up until December 7th, is the only time that you can do that. So we're just going to jump right in and get familiar with some of the lingo of health insurance policies to make sure we're all up to speed on the basics. So the first is the premium. That's the amount you're going to pay each month for your policy, and that's going to remain the same throughout the year, although it may and probably will go up each year when your plan renews. You pay your premium each month regardless of the amount of health care you use in that month. The deductible is the amount that you have to pay for health care before your plan pays anything. So, for example, if you have a $3,000 surgery and your deductible is $1,000, you're going to pay that first $1,000 before your health plan kicks in at all. The copay is a set amount that you will pay for a covered visit or procedure. For example, you might have a $20 copay to visit your doctor or $30 for a prescription, and that's regardless of the actual price of that visit or prescription. Coinsurance is the amount of your health care costs that you must pay after your deductible is met. So this is typically expressed in a percentage. So for example, if you have a $100 procedure and you've already met your deductible and your coinsurance is 20%, you're going to pay $20 for that procedure, and your insurance will pay the other 80% or $80. The maximum out-of-pocket, or MOOP as we like to call it, is the maximum amount you will have to spend on your health care in any given year. Once you have spent this amount out-of-pocket on deductibles, coinsurance, and copays, your plan is going to pay 100% of your covered health care costs for the rest of the year. So now that we know the lingo, let's look at how it works with Medicare. Medicare Basics, Medicare Part A covers hospital stays, Medicare Part B covers outpatient services like doctor's visits, and Medicare Part D covers your prescription drugs. You may have also heard of Medicare Part B, and that's just another word for the Medicare Advantage. So let's talk about Medicare Part A. For most people, there's no monthly premium for Medicare Part A. There is an exception for people who have not worked and paid Medicare tax for at least 10 years over their lifetime, but for most people it is going to be premium-free. The deductible for Medicare Part A is $1,408 in 2020. And it gets a little bit more complex, but typically that's going to be your cost for each separate hospital stay of fewer than 60 days. So this could work out okay for someone who has one short-term hospital stay in a year, but for those who end up with multiple stays per year, they're going to be paying that $1,408 deductible each time, and that deductible is going to be the same whether you stay 1 night or 59 nights. So, and then as you can see, if you stay in the hospital more than 60 days, you start having to pay a pretty steep coinsurance amount. In 2020, it's going to be $352 a day. After day 90, the only thing that you can do is you can use your lifetime reserve days. So you get 60 extra days during your lifetime that you can use beyond that 90-day stay, and those are $704 a day for each day. And then once those are gone, Medicare pays for nothing. So you're on the hook for 100%. So you can see how exorbitant your hospital costs can become if you have multiple short-term stays or even one long-term stay. So we talked about earlier, Medicare Part B pays your outpatient care costs. So for Medicare Part B, the premium for most folks will be about $144.60 a month for 2020. And I put a little asterisk on there because some people who do have much higher incomes will pay a higher premium. That's based on a sliding scale, depending on your income. But I think that's, for a household of one, it's around $85,000. So for most people, it is going to be that $144.60. So the deductible in 2020 for Part B is $198. So remember that $198, that first $198 of health care is all on you before Medicare Part B will pay anything. But once that is paid, they'll pay 80% of all your outpatient medical expenses. The tricky part is that there's no limit on the amount you can spend out of pocket. So it's not unusual with those for those with expensive and or chronic illnesses like cancer to have bills in the tens of thousands, and just 20% of that can really add up to be a huge financial burden. So we're just going to quickly look at Part D. The premiums and deductibles for Part D for prescription drugs can really vary depending on the plan you choose, and we'll talk a little bit more about that later. So the big question most people have is, how can you protect yourself against the potential for excessive out-of-pocket costs under Medicare? Well, there are two ways. So the first is to keep original Medicare and enroll in a Medicare supplement plan. These plans pay for some or all of your deductibles, your coinsurance, and your copays for Medicare Part A and B. Just depends on the plan. They do come with an additional monthly premium, but especially for those who need a lot of health care, the cost is usually easily worth it. But the catch is you have guaranteed issue rights to a Medicare supplement plan only in the first 6 months after you enroll in Medicare, or 60 days after you switch back to original Medicare from a Medicare Advantage plan, but only if you've been in that plan for less than a year since you were eligible. So it's a pretty tight window of time. Outside of that window, you can still enroll in a Medicare supplement plan, but you'll be subject to underwriting. So if you have a pre-existing condition like a cancer diagnosis, you're not likely to be able to get an affordable supplement plan at all. So if that's not an option for you, then the next option is a Medicare Advantage plan. These plans operate similarly to a commercial health care plan that you might have had through your employer before you were eligible for Medicare. You do still have to be enrolled in Medicare Part A and Part B, and you pay those premiums. And there is typically an additional monthly premium, although in some cases it can be even as low as $0 a month. Typically, Medicare Advantage plans also include a Part D plan, so it would provide all the coverage you need rolled into one plan. The key thing about Medicare Advantage plans is that they will have a maximum out-of-pocket amount. So unlike original Medicare Part B, where you're going to be paying that 20% coinsurance with no limit, a Medicare Advantage plan will have a maximum out-of-pocket amount that you have to pay in a given year. So, and after that, the plan will pay 100%. So instead of having unlimited liability, you're going to know what your maximum amount will be in any given year. For either of these options, it's best to call a Medicare broker to enroll in a plan. If you don't know of a broker, at the end of the webinar, we will provide you contact information for a broker that we work with. So what should I consider when choosing a Medicare Advantage policy? Well, as you'll see when you start to shop for a plan, there are a ton of different policies available. So we tried to narrow down the most important factors to consider when choosing which policy is best for you. So first off, is my current provider in the plan's network. If you have a doctor you've been seeing for a while or that you really love and you want to keep seeing, make sure that provider is in network on the plan that you're looking at. And in fact, I would recommend that you not only check the plan, but check with your doctor's office as well. Likewise, you want to make sure that any medications you're currently taking or that you know you're going to be taking in the future are also going to be covered under your new plan. That can differ a lot from plan to plan. Next, you also want to look at whether the plan covers out-of-network providers. Some plans, like HMOs, have a very limited network, and you're expected to stay within that network. This works fine for some people, but I've seen this become an issue when someone wants an outside second opinion or doesn't like the doctor in their network or wants to participate in a clinical trial. So that's just something to think about as well. Of course, we want to look at the cost of the monthly premiums. We want to know how much is the deductible, what is the maximum out-of-pocket amount for the policy. A little trick, if you think you're going to be using a lot of health care in the coming year and you're going to meet that maximum out-of-pocket amount, you can easily compare plans by adding together the total monthly premiums for the year and the maximum out-of-pocket amount. So that's going to let you know the most you'll be spending on health care within that particular plan. And you'll see that when Karen goes through the website. You can filter plans by doctor, medication, and all sorts of different variables. And you can see all this information on one page when you shop for plans and compare them on the website. So the website is Medicare.gov, and I'm just going to switch the screen over to this website so Karen can walk you through it, and you can get a look at what it looks like and how to navigate it.
Thanks, Rachel. And before I begin, for the participants here, on the upper right-hand side of your screen, if you would like to ask us any questions, you can type those in. There's a little person up at the top, and you can just kind of type in your question, and we can answer those when we're finished with the presentation today. So Rachel went through the various things that you can do on this site, but I'm just going to take one example and go through this and give some navigation tips. So when you're signing up for Medicare or when you're just kind of checking what is available to the broker, you'll have a little bit of knowledge about it. So on the site, a place to start is obviously finding your 2020 healthcare coverage and plans. That will get you to this next screen. And rather than logging into an account, you can certainly do that down the road if you want to sign up here, but we continue without logging in for our purposes here. Then they're going to go to questions on what you'd like to do on the site, which is whether you're looking for a Medicare Advantage plan, drug plan in combination with a Medigap policy or supplement, Medigap only, and what we want to do today is just kind of explore what's available in the way of Medicare Advantage plans. We're going to add your code where you live. So we're just going to put in Denver here. We're going to go down the screen and actually use some questions after you've kind of put in your zip code. There you are participating in a paid plan supplemental. So for our purposes today, we're just going to say we get no additional help from any of these programs. We'll go to the next. So they're asking us at this point, do you take any drugs, and would you like to check and you can actually end drugs. So yeah, we wanted to put some drugs in here and see if what pops up in matching for our policy. They ask you whether you get your prescriptions at a retail pharmacy, order, or both. We're going to retail. Okay. Hold on. Okay, so here is you about the what drugs you have, and they do those alphabetically. So we're going to go down and pick a quick drug here and put it in. Okay, we're going to add the drug. Then they're going to ask for the dosage up here at top. We're just going to just fill in a dosage. We're going to say, oh, it may do 3 of those a month or 30, and then every month, and then add that. And we'll do one more drug as well. Go down to our list and find another drug. So we'll go down to, get another letter here. We'll go to letter C. So. Yeah, hold on a sec. Well, we'll just look at another one of these here. So we're going to go down and add that drug, and we're going to again select the dosage up here. And then we'll put the quantity. We'll put this time for 1 a month. And then we'll also add that drug. Okay, hold on a sec, hold on. Okay, just need you to scroll down, Rachel. Thanks for bearing with us. We have a little glitch in our system here, so. Okay, now we're going to re-add those drugs. Okay. Again, select the dosage, the quantity, and then every month, so we'll add this drug to the list. Okay, so we have now currently the 2 drugs that we want, so we're going to say we're done with that. That's all the drugs this particular patient's going to take. And they're going to ask you what pharmacy that you would like to pick up at, and they combine that with the 205 area code that I put in, the closest pharmacy. So we're going to pick this pharmacy here and the Walgreens. Okay. And we are done with that. Okay. So now they have pulled up 37 different Medicare Advantage plans that we can choose from. You can filter these. Let's see, Rachel. Okay, there we go. So they start off with, you can see on the left-hand side a road premium, monthly premium, and a health plan deductible. They also do the drug deductible. And on one side, they have your med pocket. And as you go further along, there's a substantial availability here, but typically the lower premium would result in a high pocket cost. If you have a premium, and that would max out of pocket costs. What you can also do here, they rate these plans. You can kind of see on the right-hand corner there that this particular plan gets a 4-star, and you can kind of take that into account as well. It also gives you the details. If you want to go here, you can actually enroll from this site. On the far right side, you can click, if you find a couple of these plans that you think might work for you, you can kind of click on that, click on a couple of them, and what that'll do is bring you to, it'll do a side-by-side comparison of the different plans. Full plan details, we click on that. That's where you kind of get to the point where you can figure out whether your physician's office is going to be in, we're loading here, if your physician's going to be in your network. So we kind of go down, and you can find information through the View Provider Network Directory. We won't go into that because that actually goes into the website for that particular carrier. So we go back on screen. Okay, it's the basics. We combine terms that Rachel went through so you can kind of see what those costs would be. Rachel and I are not certified brokers, but we do have brokers that we work with that have done a good job, and they can assist if you don't have your own broker.
Okay, so thanks, Karen, for going through that. And like we said, we can help you go through that. We are not certified brokers, but we are able to help you kind of walk through that website if you wanted to get on the phone and do that, or sit down in person and just help you kind of comb through those plans and narrow it down to see what might work best for you. But last but definitely not least, we wanted to touch on briefly is the financial assistance for Medicare-related costs. For lower-income Medicare beneficiaries, there are programs that will help, like the low-income subsidy for Part B, as well as Medicare savings programs. So if you've been diagnosed with cancer and you're in active treatment, we can oftentimes find help from private foundations to help pay those premiums or to help pay some of the copay or coinsurance costs for treatment. So if you are having trouble affording your Medicare premiums or the out-of-pocket expenses for your health care, let me or Karen know, and we will work with you to see if we can help to minimize those for you. And so this has our Medicare broker, Joel Rosenblum. He is not affiliated with COCA or with Carol's Wish. However, we just do work with him and refer people over to him, and he's done a pretty good job. So that's his information there. And I will just leave ours up on the screen, and if there's any questions, then we'll go ahead and answer those.
Are we all unmuted right now?
Just you.
Pardon? It says there's 7 participants, and I guess I just wanted to know if we were unmuted. Can you hear me?
Yes. I think.
Do you guys have biggest pitfalls that people should think about trying to avoid, or best practices in the way you look at your own coverage?